So now we're going to do a little bit of work on Milo's right side. I usually start off with some massage and joint stretching. First off, by massaging, I'm relaxing the muscles around the area in which I'm going to be needling, so it's more comfortable for insertion. It's also allowing the animal to be aware of my touch and the fact that I'm going to be doing some manipulation with their leg, so that way they're not surprised by it. The other reason for doing some of this manipulation of the leg is so that I can see what they're doing from a clinical perspective as far as responding to therapy or what kind of range of motion they still have, and also be able to tell if there's something else going on that's now a problem. So with Milo, I'm doing some gentle stroking massage down his hamstrings, also his quads, the outside of his leg, looking for any reactivity, either a muscle tremor or a little trigger point in the muscle. Massaging up around his hip joint, since we're going to be needling there too. The muscles feel pretty good. I'm not getting a lot of reactivity from them. They feel pretty normal as far as the amount of tone. Good job, buddy. There's a little bit of resistance to abduction, so trying to bring his hip out, which is just because he's got some hip-related issues going on too, but that is a little bit, there is some more resistance there, so it should more readily come out away from his body without having to apply that much pressure. I only go to the point where the animals are comfortable with it. I don't ever stress a joint because that's going to create inflammation and irritation. But at the same time, we want to get some stretching because it's going to help make that joint more flexible. And it's also going to feel better once it starts moving a little bit better for them. Good job, buddy.